Welcome to another episode of Aging Choices Unfiltered. I'm Terry Sullivan, the co-founder of Aging Choices, and I'm joined by my fellow co-founder, Brenda Lamone.
Hi, Terry. There's been a lot of attention on seniors and senior living communities during this COVID-19 crisis. And on today's show, we're going to address the question, are senior living communities still open for business?
That's right. So we now welcome Ted Doyle, Vice President of Marketing and Communications for LCB Senior Living, to the show. Thanks for joining us today, Ted.
It is my pleasure to be here, guys. Thanks for having me.
Okay, let's jump right in on the topic for today. Ted, are your communities still open for business?
Some of them are, yeah. I mean, obviously we've been caring for people all along during the pandemic. We shut down admissions pretty early on with a bunch of other fairly aggressive, proactive measures that we took to try to keep people safe in our communities. Different states have different regulations. And, for instance, the Commonwealth of Massachusetts released some, the governor released some orders this week that allow us to open up some of our communities to various activities. Connecticut has done the same. Rhode Island stays fairly conservative. Vermont is opening up. So we're kind of doing things in concert with the local departments of public health. And also, honestly, we're listening to our own inner voice and doing things our own way. Our philosophy at the beginning was to be proactive and do things early. And now our philosophy is let's watch what happens and lag it by 10 days or so and see how things are going, because we have to protect our residents. So we are accepting residents in communities, new residents in communities where there is no disease. That's, at this point, about 10 of our 26 communities are virus-free and have been, some of them all along. That number is growing by the day.
Ted, so with new residents, how are you ensuring that you're not having new residents move in that do not have COVID-19? What are the processes and steps that you're putting in place?
We are asking the residents be asymptomatic for at least 2 weeks prior to moving in, regardless of their health situation, that they have 2 negative COVID tests within a 24-hour period just prior to moving in, that they allow us to use our movers to move their furniture into our building, and that they agree to self-isolate for 14 days after they move into the building. So we have a full month of time, asymptomatic, plus the tests. We think that's a prudent way to proceed at this point. Obviously, things are changing by the day, but that's what we're doing right now.
So those measures sound very thorough. Are you finding that those measures are working inside of your communities?
Yeah, I think the best way to illustrate it is the fact that two of our communities, when we did testing of everyone, associates and residents, we had a handful of associates test positive and no residents. So that shows you that someone wearing a mask properly, wearing the proper protective equipment, and behaving properly in terms of hygiene, washing hands, and that sort of thing, can prevent the spread of this virus, not only in a building like ours, but in society in general. So yeah, I think that it's pretty clear that following the right procedures definitely contains this virus, in our setting.
Interesting. I cringe when I think about turning on the news and hearing about nursing homes and the impact of COVID-19 on nursing homes, the families and the patients and or residents that are in these communities. Would you be kind enough for our listeners to talk about the difference between nursing homes and senior living, and why nursing homes seem to be, more at risk for COVID-19?
Yeah, I'm happy to. In general, nursing home residents tend to have higher acuity. So they have much bigger health demands that need to be met. And from a licensure standpoint in Massachusetts, for instance, you're allowed to perform certain medical procedures in a nursing home, whereas under an assisted living licensure, you're not. Everything that we do is non-medical and helping with the activities of daily living. About the most medical thing we do is medication management. which in some instances is actually handing someone medication, but most of the time it's just reminding them about it. So that's number one. So it's a difference in population and resident. Number two, the spaces in nursing homes tend to be more generally communal and smaller. Assisted living, with its memory care component, was kind of a departure in the early 90s, where people went from that almost like a hospital setting, nicer than a hospital, but similar in layout, to what's more of a grand home and what you see in typical assisted living. So there's a physical difference as well. It's a real tragedy. It's a real shame that folks in memory care settings generally fall victim to this virus more often. There's a couple of factors behind that. Number one, most, if not all, of our memory care folks and people in nursing homes have issues with keeping a mask on. So you'll give someone a mask and they'll immediately take it off because they're either agitated by it or they can't remember why they're wearing it. They get uncomfortable and they just take it off. So similarly, we can tell people to socially distance, but they aren't always able to hang on to that advice and do it. So you tell them that, they do it, and then 10 minutes later they might be up hugging someone or getting close to people. And so it's very, very difficult when you get a couple of cases in a nursing home or in a memory care setting. It's very difficult to prevent its transmission at that point. And that's why you see kind of hot spots in neighborhoods where one community will have nothing and remain that way, and another will have one, and then it becomes 10.
Wow, that's really interesting. I think a lot of consumers don't understand that inside of nursing homes, or what we refer to in the industry as skilled nursing, is that there's a short-term rehab component, right, and then a long-term care. The short-term rehab component is people are coming in and they're recovering from illnesses or they're recovering from surgery. And then the long-term care folks are like you spoke about, right? They need more services. They need 24-hour skilled care, and that's the reason they're there. And then, of course, there's people coming in and out of the building quite a bit to help serve these folks, right? So it does put them into a very tough position in trying to control all of those different environments. So
in our buildings, we can tell our residents to self-isolate, and they understand what that means. They take it seriously, and they do it. So it makes it much easier to contain things. Similarly, as you just said, folks in nursing homes tend to be, as a rule, unhealthy relative to your typical assisted living resident. And COVID, it preys so voraciously on people who have any kind of weakness. So you're seeing the result.
And it's tougher to isolate them in that environment. You can't. Yeah. It's definitely different. Yeah.
You can't lock the doors.
Right.
I guess people can, but we don't.
That makes sense.
Yeah, I saw it firsthand, and I had my father in memory care and my mom in independent living, and it was definitely two different environments. Very fortunate the cases are very low where they are, but still two very different environments. Yeah.
Mm-hmm.
Yeah, and Brian, you were impacted by the non-essential workers not being allowed into the community with visiting both of your parents, correct?
Yes, and we still really can't get in there. They are letting them out a little bit. My mother's very independent and can drive, but not more than 24 hours. And if they do, they're isolated and quarantined for 2 weeks. So they're being very, very careful where they are, but no one really can come in.
Yeah, we don't have anyone coming into the building who's non-essential. We are starting to do window visits at some of our communities where the states allow. We do have a phase 1 plan that we've formulated an entire plan, 4-phase plan, but we're ready to implement phase 1 in some places, which will start to allow for what we're calling porch visits. We're creating little areas outside under cover where people can visit with their family members. We're not in phase 1 allowing inside community visits yet. Because we feel like we have to be conservative. And as the summer wears on, we think we'll move to phase 2 and start to allow that as well in a very measured way. But the irony of what you're talking about is not lost on anyone. We exist as an industry to save people from isolation more than anything. And to have to enforce isolation as part of our service is so counter to everything that we stand for and believe in and want to do for these folks. It's just been devastating for the caregivers who can see the effect. And I'm sure, Brenda, you saw it with your dad, to see the effects of isolation on these folks. It's really, really hard to, it's hard to bear, and talk to the families, and they're understanding and thankful of our measures,
Yeah.
but are in such great pain because they can see what it's doing to their folks.
Yeah, and it was so immediate. I mean, even though my dad was in memory care, my mom was visiting him every day. And then when he couldn't visit, even though he was, had memory issues, he knew she wasn't coming. And that's when he started declining. And then providers build these communities with, smaller rooms in big community areas because you want to encourage those communal settings. And now being isolated in those very small rooms, having meals brought in, when you're in a memory care unit, very difficult. Very, very difficult. Yeah.
It really is tough.
Yeah.
Yeah, I think that the isolation piece is probably one of the biggest things that's going to come out of this for older adults living at home, for families that are taking care of older adults living further away. I think it's going to bring a whole new look at, I think, senior living in general. I think home care there's always a place for home care. But for senior living in general, I think it will most likely open up a very large opportunity, because even if you are isolated in senior living, at least somebody is available for you.
Yeah.
And they're there for you. So I think that's really interesting. So what's the staff doing inside of your communities, Ted, to help keep the safety, well, maybe the better question is, what steps are you taking in your communities to help protect the safety of your staff and residents?
Yeah, I mean, obviously, staff is the major mover of the virus. I don't think a lot of people talked about it, but it hasn't been a secret to anyone who's in the business.
Sure.
We know that that's how it comes and goes. And we've had medical professionals say to us, you just, forget about not having virus in your building. The battle is fought at the threshold of the apartment and in the interaction between people. The virus is everywhere, and it's with people who are living any kind of normal, or what we would consider a normal life over the past 2 months. Everyone is going to the grocery store once a week, the liquor store, places like that. And the virus does fall to the ground and people walk on it. And so even at that level, it's being transmitted physically or transported. So again, very early on, I would say first week of March, we instituted a policy where we locked all of the doors in our community, including the front door. They were open for escape, but not for entrance. And every visitor, essential visitors only, we limited that to associates working in the building, essential medical personnel, and families in situations of end of life who needed to visit their loved one. And we limited that too, which has its own difficulties, obviously emotionally. But that said, we every person who comes to the door, rings the doorbell, is greeted by a concierge who gives them the questionnaire, the typical questionnaire that we've all heard a million times at this point, asking about where they've been and who they've been exposed to, but then also getting their temperature taken and then being required to put a mask on before they enter. They come into the building, our associates and anyone who's in the building for any purpose is wearing a mask all the time. We ask our residents to wear masks all the time when they're in the community outside of their apartments. If someone is exhibiting any kind of symptoms at all, even COVID negative symptoms, we put a sign on their door that says, "I'm a little under the weather. Please make sure I'm wearing my mask when you come in." As many of us know, it's the person who's sick is most likely to transmit, and they're the ones who really need to wear the mask, in other words. So our associate is wearing a mask, de rigueur, and then going into the apartment of someone who's got any kind of symptoms, that person's wearing a mask as well. If there's any kind of close interaction, we ramp up the personal protective equipment, the PPE, to full gowns, booties, face shield, gloves, the whole 9 yards. An associate goes into the apartment, maybe delivers a meal, and And then as they're leaving, they're sanitizing the doorknob on both sides, changing their gloves, washing their hands, and moving on to the next task. So that's one way. That's managing that threshold interaction, as I was saying before. Obviously, in situations where people have to be out of their apartment and among other people, we're exercising social distancing. Again, having people wear masks all the time as a precaution. We've obviously suspended communal meals. That, again, goes back to the first week of March.
Yeah.
Residents take meals in their apartments. Memory care is a little bit different because people need supervision when they're eating in some cases. And so we do these very small, like 4-person shifts, very well distanced in the dining room where they can get assistance with their meals. Otherwise, everyone else is receiving meals in their apartments. Engagement activities, again, part and parcel of this isolation issue, have been suspended in a communal sense. We have people doing things in doorways, exercise classes, playing games, doing quizzes, getting lectures, hearing music.
But they're doing it from the doorway.
Yeah, so
Happy hours, I hope.
that's everyone's safe space, not to mention happy hours. As long as we're safely seated, in my case. And I would have a seat and my feet up. But yeah, we're doing our best to keep people socialized. They're visited by personnel, regardless of what's going on, 4 times a day. And our associates are really encouraged to spend time with the residents and talk to them and ask them questions and help them reach out to their loved ones through Skype or Zoom or any number of the face-to-face platforms that are available to keep them in touch with people. And so, we attribute a really strong adherence to all those principles on top of, some pretty strict cleaning, disinfectant measures we've been taking. On that score, we've been using a pretty advanced electrostatic cleaning solution, which sprays a very fine substance that kills the virus on contact and continues to kill it for several weeks. That's been part of our regular cleaning protocol in all of our buildings, along with, regular, repeated, frequently touched surfaces being wiped down with sanitary cloths and using spray and so on.
Yeah, some of the things we're all doing in our own homes, right?
Yeah.
Getting everything cleaned and wiped down as much as possible. So,
And
testing.
we've also, I'm sorry, one more thing.
Keep going, please.
In the instance that someone becomes ill or has symptoms, we're immediately testing them. If one of our associates suspects that they've been exposed to someone who's had corona, they are sent home immediately. That's part of the questioning process when they come in the building, and they're paid during the time that they have to quarantine at home. We want to avoid people feeling the financial pressure of quarantining, and that's been very helpful in keeping our staffing levels sustainable. Obviously, anyone who falls ill from the resident population, we send them to the hospital where they get checked out. Sometimes the hospitals will send them back if their symptoms are very mild, and they will quarantine in their apartment until they receive 2 negative tests, excuse me. Similarly, our associates cannot return to work until they've tested negative twice. I'm hung up on the fact that negative is positive, in the emotional sense.
Yeah.
But on that same score, all along the way, if residents choose to leave the community for any reason that's not an emergency medically, we've required them to stay away for 30 days after that and come back with a negative test.
Oh, wow.
Yeah, and that's been a very tough measure, but again, we really attribute those kinds of things to keeping our residents safe.
You have to.
We've reduced that since to 14 days.
Wow.
And that's kind of a good overview of the things we've been doing.
That's a lot. I mean, that was really informative. There's a lot there. The thing that's always been an issue in the news, Ted, is, testing. So are you finding that you're able to get the tests you need right now for your staff and your residents? It sounds like you are, but it would be great to affirm with consumers that that's the case.
Well, Massachusetts, the National Guard program has been unbelievable, and they've been very responsive. I'll be frank, the first 6 weeks were a nightmare. We were all being told that there were endless tests, but there were none. And you had to be significantly symptomatic to get a test, which was really what set us all back initially. because as we all know, most people are asymptomatic when they're spreading it. So I would say in the last month and a half, 2 months, since Governor Baker really mobilized the National Guard, and that's happened in other states as well, we have had easier access to at least 1 or 2 waves of testing for residents and associates. At this point, it's not a problem to get everybody tested at least once. We've also been aggressively pursuing private test kits to have on hand, and we have been successful in doing that. It's very expensive, but we have been procuring tests as fast as we can so that we can test when we feel like it's necessary to test, which I think is a little more aggressive than public health officials. We really are trying to be very aggressive about it. So it's gotten better. It's getting better by the day. Same thing with PPE. I mean, I think a lot of people saw the opportunity to make some money, and they've ginned up their PPE production in the last 6 weeks. And
Yeah, I was going to ask about that. Yeah.
Let's just say the mask price is going down.
Yeah.
So we're taking advantage of that situation, and we're planning for the future. We're stockpiling materials. We're rolling out. We're unfurling these reopening plans at the same time we're planning our what happens in the fall plans. So it's we're just really trying to stay ahead of things at this point.
Stay in the now, figure out how it's going to work in the new normal that we're all seeing here, preparing for that future. Wow.
Yeah.
Sounds like you guys are doing a lot. So it's great to hear that.
Our folks in the field have done an amazing job. I mean, we've had pretty low numbers. We've had a couple of communities that were hit fairly hard. But generally speaking, we fared quite well, but it's really because our folks, I mean, everyone's got good people. I don't mean to say our people are better than other people, but I just think that the system we put in place was very effective. And our folks who, like a lot of people in this industry, it's a mission more than a job. They carried it out to a T.
So you mentioned keeping residents active, engaged, being in their doorways, which I haven't heard before. I think that's amazing, making sure that they're participating in still events and activities. A lot of folks out there are using some technology to help engage the residents with their families. Have your communities been using Zoom or FaceTime or anything like that to keep people connected during these times?
Yeah, we've again, pretty much all along been really aggressively urging families to connect that way. It has a marked impact on the residents, and obviously it means something emotionally to the families as well. So yeah, we've been using Zoom, GoToMeeting, FaceTime, Skype, all the typical platforms, Messenger, video.
Yeah.
It does make a difference. The staff was amazing where my dad was, and they were doing, they would do it for them, the face. But now I got my mother doing FaceTime, and it's hilarious because, I can just see like her forehead, and but God bless her, she does it, between that and her iPad have saved her sanity. So solitaire and a few other things, but and then the TV station I don't know if your community has a TV station that they're doing the exercise and they're doing religious masses and things like that, which is helping.
That stuff's all super important, mass and to exercise. Those are important things to people, obviously. We also were doing window visits at the beginning and had issues with people, abusing that situation. Yeah. Talking through open windows and so forth. We actually, had to shut that down through much of the last 2 months, which was a really hard thing to do. But again, we've really had to prioritize keeping people safe over sometimes what might be day-to-day something that was really beneficial to people. It's one of the really hellish things about this virus. It forces us to do things like that. That's coming back now.
Yeah. We're phasing that in. So I imagine, as somebody who's been in marketing and sales for a long time, and how is the message now changed to consumers? I mean, the industry itself has a challenge where we need to educate. So people understand the differences, of course, between nursing homes and congregate or senior living.
That's big.
what are consumers, what can you tell the consumers about how you're going to engage with them, or what are some of the thoughts on how you're going to move forward? I've heard some communities using virtual tours and doing ways to keep potential prospects who still are interested in senior living going. Maybe you can just talk a little bit about what that future looks like for you.
Yeah, I mean, we have been doing virtual tours for quite a bit at this point. All of our communities already have Google tours, which people can take themselves. But we've also been using the One Day platform, which is one of our
Oh, that's great. Yeah, that's
one of our vendor family. Yeah,
Yeah.
we all know those guys, and they do a great job. We've been using One Day to create virtual tours. We're also doing live tours with people who will walk around with an iPad and show people around. Obviously people pulling the trigger has slowed down. We still have about the same amount of web traffic, but a lot less buttons being pushed. So people are kind of, I think particularly independent folks are taking a little bit of a wait and see attitude. That's very understandable. As you get into the assisted realm and the memory care realm, it's a more of an emergent thing. So we have had a lot of inquiries about moving in all throughout this crisis. So we've opened up move-ins wherever we have no COVID in a neighborhood. So if we have a case in memory care, we still will allow someone into assisted living or independent living, as given that they're very physically separate parts of the building. And so that's been our rule of thumb. And at this point, I would say almost all of our communities are back and accepting residents. We have a couple that are not. How the message looks, I mean, it used to be that we were competing with staying at home and cost issues and am I going to be happy there issues? Is the food going to be good issues? Now it's fear. Now our biggest objection is, am I going to be safe there? So we are really working hard to show people, number one, that we understand that concern and we're empathetic to it, but number two, that we're actually doing things to make things safer. In some ways, you're gonna succeed or fail on your reputation for a while. I mean, if you've got a neighborhood that got really slammed, anything, no matter what you say, people are going to be hesitant for a bit. You've got to rebuild that safety reputation.
Yeah.
But in other places, it's more about people, especially people with an emergent need. It's showing that you, number one, are empathetic to what they're worried about and not dismissing it and not saying it's not valid. So our approach has been to say, yes, of course it's valid. Of course we're all concerned about this. We are maintaining many of the standards that I've described already in our buildings for the foreseeable future. People wearing masks and so forth and being screened, and that's not going to go away. We have, the electrosec cleaning, we used to contract it out, and now we own the equipment, and it's going to be the way we do business going forward. Our air handling systems are all being overhauled and optimized. They're already a higher grade than you would get in an apartment building or someplace like that. It's not the kind of air handling you'd have in a hospital, but it's in between. It's much more sophisticated than typical. And so we're optimizing those systems to keep the air circulating and clean. We're not jumping right back into full communal dining. We're not jumping back into full communal activities or engagement. For us, it's about setting up an environment where people know we're going to be cautious. At the beginning, people were kind of mad at us for being so draconian in what we were doing. And now the messaging is all, thank you, thank you, thank you.
Yeah.
Because so many of our communities have fared well. And so, we are not going to give up that position. We've always believed that it was the right one to have. And until there's a vaccine, at the least, we're going to be continuing some of these practices.
Yeah.
We're communicating that to folks, not losing sight of the traditional benefits of our communities, care, our dining, service, but it's our new thing is safety, where safety meets service, where safety meets care, where safety meets savory. So just sort of, keeping people aware of what, the comforts of living in our community, but addressing the number one concern that they have, which is, am I going to be safe?
Safety. Yeah. Well, that's really informative. Really great.
Ted,
Always great talking to you, Ted.
yeah, it is always great talking with you. If you were to leave consumers with one thought that you'd like to share, what would you like to share?
That we care about your mom or dad, not as much as you do, but a lot. Most of us, like Brenda and myself and Mike Stoller, our CEO, we've had parents in our communities, and we know what it's like to worry about a parent under normal flu conditions, let alone something like this. The other thing is, because of what we do for a living every day, our buildings are already prepared to deal with virus. The flu can be every bit as dangerous to an individual as COVID is. We're not comparing the two at all. But the fact of the matter is the flu is deadly to seniors. And so every day, forever, we have been prepared to contain and deal with virus in our buildings. So we've had to step up our game with this one because it's a little bit more deadly, this one.
What I say to my family, Ted, is that infection control is not new for this industry.
No.
I can't tell you how many times I've gone to visit a community and then been told I can't because there's a stomach bug or this or that. It just stepped up to a different level. It's just a different level.
Yeah. The principles of virus containment are not different at all. It's just that this one is a little bit more fearsome of a virus, and we want people to avoid it, obviously, because of that.
Yeah.
But the principles of containing a virus are all the same.
Yeah. Well, this has been amazing. Truly thank you for coming on and talking about this. It's all really important topics, and we need to be more transparent and have conversations like this so we can educate consumers, any older adults out there that are listening, or family members. Thank you, Ted, Doyle, for taking the time to spend time with us. So we really appreciate it.
You're welcome. And I should say, a little shout out to our families who have been incredibly patient and supportive of what we've been trying to do here when it's been difficult to do so. And it's ever more difficult right now when it's warm weather and it feels like things are getting back to normal. Their patience has been huge. We've been communicating constantly, which has helped a lot. But the families have really been part of the success that we've had. It's had a lot to do with them.
Yeah.
Oh, it's great.
As well as your workers and your staff, right, Bren?
Yeah.
Yeah. These are saints.
Yeah.
These are saints.
Yeah.
We can look at it and say, well, that the vast majority of people who are really suffering from this are older or compromised, but no one knew what the extent of it was on March 15th.
Yeah.
And our folks and other people's folks, our competitors' folks, were walking into those buildings, doing that work because they knew that that's what they had to do. Yeah. And it was selfless and heroic. I think that word could be overused, but it's true in this case. It really is. Because I've had to go to the buildings a couple of times. It's scary.
Yeah.
It's scary to walk into those buildings.
Yeah.
Yeah.
And these folks are doing it every day with people they know are sick.
Yeah.
I know. It's really amazing. I had to go into the building once, and you think of that. Even going to the grocery store, you think of it. You go in once, and these people are going in every day and working. You
get to hold your breath for half an hour and then run out the door.
Right, and get the hazmat suit.
I got incredible breath holding skills now because I could do a whole shopping trip on like 2 breaths.
Yeah, exactly. But
there's a lot for a person in marketing.
That's right. I'm not talking the entire time when I'm shopping.
No, thank you, Ted.
Really appreciate your time that you spent with us. And, I know this is going to be helpful to our listeners.
Well, I hope so. And thank you for having me. As always, I love talking to you guys.
That's it for this week. Don't forget to follow us on Facebook and Instagram at Aging Choices and Twitter at My Aging Choices. And check out the Choice Wizard for personalized recommendations for senior living and home care for you or a loved one. Thank you for watching.